Good morning to you who make this broadcast possible and to all those who tune in. We begin today's information by regretting the death and giving our condolences to the family, colleagues, and friends of a 58-year-old Cuban citizen of the city of Matanzas, who had as clinical history a long neoplasm with three years of evolution. After a hospital stay of 10 days, 5 of them in intensive care, in fact, he was admitted because of his condition, not because of respiratory symptoms. But later, it was necessary to intervene with the evolution of a group of complications, and when the high fever appeared, studies were made to rule out COVID-19, and regrettably he died, and he was confirmed he had COVID-19. Although he really suffered from one of the most serious diseases, we are very sorry for his death, and we convey our condolences to his family and colleagues. In Cuba, as of 12 o'clock last night, a total of 1,148 patients had been admitted to hospitals, 34 under surveillance, 667 suspected, and 447 COVID-19 positive patients. In primary health care, a total of 3,907 people are being monitored for some kind of risk of the disease. To detect SARS-CoV-2 virus and COVID-19 disease, 1,975 samples were studied yesterday. 21 of them were positive. That amounts to 1.06% of the samples studied. In this way, using the PCR laboratory tests in real time, and I especially say this because there are all the people who have undergone rapid tests, and which is another way of diagnosis and detection of the disease. And we're going to report about this soon. This procedure helps detect when a person is infected with a disease. As I was saying, 71,157 samples have been studied in our country with a PCR test to detect this disease, and 1,804 have tested positive, or 2.5% of the samples studied. The 21 new cases confirmed yesterday are all Cuban. 20, that is 95.2%, are contacts of confirmed cases, and already in the behavior of the epidemic in our country, 1,581, that is 89.7% of all confirmed cases, have a relationship with contacts that had been confirmed previously. In one of all the cases, the source of the person's infection was not specified, and it's being investigated. To date, in the cumulative total of all the cases whose source of infection has not been established, is 3%, that is 52 of them, their source of infection remain unknown. With the source of infection abroad, the figure remains the same, 130 confirmed cases. Of the 21 cases diagnosed yesterday, 12, that is 57.1%, are male. In the cumulative total, we have 930 of the male sex, 51.6% of all the cases confirmed in Cuba. Yesterday, 9 cases were female, And in the cumulative total, 874 individuals are female. Of the 21 new cases, 80.9% were asymptomatic. That is, at the time they were diagnosed, they showed no symptoms of the disease. That is, 17 of them. And since the epidemic began on the island, 48.7% of all COVID-19 positive cases in Cuba, 880 people have been asymptomatic. The age groups most affected yesterday were the group of under 40 years with 9 cases, that is 42.8, and from 40 to 60 years with the same number, 9 cases, also 42.8%. Yesterday, one 9-month-old child from Havana was confirmed a contact of a positive case. The province with the highest number of confirmed cases yesterday was Havana, with 19 of the 21 new cases. This represents 90.4% of the cases reported yesterday. Of the 1,804 diagnosed cases so far for the disease, 447 remain hospitalized. These are the cases that we describe as active cases. Of all confirmed cases, these are the ones that remain admitted in hospitals. Of these 447, 443 or 99.1% have stable clinical evolution, and this is satisfactory from the clinical point of view. With the death announced today, there is a cumulative total of 78 deaths. This represents a lethality of 4.13%. And I always make reference to the lethality of the region of the Americas. Cuba has a 4.13%, and the lethality in the region stands at 5.94%. Cuba used to be in the 12th, 13th place. Now it currently is in the 14th position. And of the 35 countries of the region, 13 have rates above the regional average. So this hasn't changed much from what we've said in previous days. And Mexico has 9.89, Brazil 6.84, the United States with 5.98, Canada with 7.08. In the Caribbean region, there are several countries with high lethality rate. And we say this because yesterday when we were watching television, we saw that many countries have already dismantled the restriction measures, and they have been opening up and returning to normal life, opening centers. And also, as we saw yesterday when we showed the graphs on the curves and the behavior of the epidemic in some countries in which the cases were diminishing, and suddenly they had a rebound of the disease. And this shows the risk that is taken when restrictions are lifted. That is why, regardless of being on the 14th place, we have been several days with a number of confirmed cases much lower than the number of discharges that occur on the day, which is positive. There are more discharges than confirmed cases, but as you can see in our country, and especially in certain provinces and in certain municipalities, restriction measures are increasing because that's the only way to sustain these results. I always mention the 2 foreigners who were evacuated, and yesterday there were 48 discharges for a cumulative total of 1,277 out of the 1,804 who have been diagnosed, who have recovered, and who are either under quarantine in their homes or have returned to their habitual chores. This number of discharges represent 70.7% of all COVID-19 positive individuals in the country. Today we have to report 2 patients in critical condition, one more than yesterday, and 2 cases are reported in serious condition, 4 less than yesterday. And this is something positive from the point of view of the evolution of the patients. In Cuba yesterday there were no entries of foreigners, therefore there is a total of 6,524 Cubans who reside abroad in our country, and 4,258 foreigners staying on the island. No changes either in rental houses, 940 in the municipalities of Santiago, Plaza, Centro Habana, and Playa, with the highest number of foreigners in rental houses. Until 12 o'clock last night, 184 countries in the world were reporting COVID-19 cases, with the confirmation yesterday of 77,406. The world has reached the very impressive figure of 4,062,525 confirmed cases. Of them, 282,244 have died, with the death yesterday of 3,430 people. This gives a lethality in the world of 6.95%. The region of the Americas reports 1,772,622 confirmed cases, 35,912 more than yesterday, and the region represents 43.62% of the total number of reported cases in the world. In the region, 2,057 people died due to COVID, for a cumulative total in the region of 105,317 deaths, 2,830 more than yesterday, which gives a lethality of 5.94%. And with this, we conclude the information we had for you today.